Good morning, good evening, friends. In our previous lecture on the chronic disease, we had been talking on the each and every paragraph of the chronic disease of the Dr. Hahnemann. And in today's session, we are going to take up the up to now we have discussed on the fifth paragraph, but and today we are going to take together the two sessions, that is the sixth paragraph and the seventh paragraph. Now, sixth paragraph uh, is related to the uh, essence of the strength of the medicines. And Dr. Hahnemann had earlier in the last paragraph talked about the in context with the bloodletting, mercury therapy, and strong purgatives and their its effect. And he concluded that this type of the treatment usually weaken the patients, making later recovery more difficult. Now, in coming to the sixth paragraph, Hahnemann explains how homeopathy actually works in practice and why it is superior. He said that the homeopathic physicians, by following the natural method, were often able to remove chronic disease in a relatively short time. The key to this success was careful observations of all symptoms, everything that can be perceived through the sense. And after understanding the complete symptoms picture, the physician select the most suitable remedy from the homeopathic materia medica. Importantly, these remedies are used in very small dose and their effects are already known through the drug proving. So Dr. Hahnemann emphasizes that this treatment does not weaken the patients, unlike allopathic methods, but rather it removes the allopathic medicines that remove the blood and fluid and reduces the strength. So homeopathy preserves the and support the vital force. As a result, patient not only become free from the disease but also able to return to the joyful and healthy life. He further stated that such cures are far superior than the occasional success of the allopathic physicians, which he described as a lucky chance rather than result of scientific method. So this paragraph highlights the scientific, gentle, and reliable nature of the homeopathic treatment. Now, the interpretations of the word that used in this paragraph are natural treatment means treatment in harmony with the vital force. Perceptible symptoms means observed totality of the symptoms. The smallest dose is equal means the minimum drug principle, and proved medicines remedy means drug proving on the medica, and without robbing the strength means not debilitating, not weakening the treatment. And this was in context with the bloodletting and purging reduced body fluid. And the large dosages causes toxicity and no symptoms systematic drug proving was existed. So Dr. Hahnemann in homeopathy introduced observation-based prescriptions, minimum dosage, and drug proving. So clinical understanding from this paragraph is case taking must be complete and sensory based. Remedy must match the totality and use of the minimum dose and avoid weakening the patients. So now coming to the seventh paragraph. In this paragraph, Dr. Hahnemann explains the limitation and partial success in the early homeopathic treatment. He says that many diseases improved with a small dose of remedy that produced similar symptoms. However, this improvement depends on certain conditions. If the disease was not too old or deep-rooted, and if it has been severely disturbed by previous allopathic treatment, then the patient often experience long-lasting relief. Because it is of this improvement, patient felt grateful and considered themselves the most almost cured, and when they compared their present conditions with their previous suffering, and they felt much better. Dr. Hahnemann, however, introduced a important deeper idea here. He explains that many of these cases were not completely cured, but only temporarily improved. So in the footnote, he clarifies that such cases were often related to the SORA, which was not yet fully understood at that time. And the remedy used were not true antisoric remedies, so they only removed the surface symptoms. As a result, the disease became latent, hidden inside the body, and the patient appeared healthy for a long time, especially if the patient was young and strong. But in case of the where SORA was fully developed, these remedies were not sufficient for the complete cure. Thus, this paragraph prepares the Hahnemann's major discovery that chronic disease requires deep-acting mimetic treatment and not just the superficial symptoms. So, what I can say that the seventh uh, in the seventh paragraph, he declares about the discovery of the majma, majma. Or now coming to the uh, key word interpretations. Very small dose means the minimum dose. Morbid symptoms is equal to disease symptoms. Invertebrate disease means deep-rooted chronic disease. Mismanaged by allopathy means suppressed or complicated case. And SORA means the fundamental chronic disease, MAS, and latent state means hidden disease conditions. This the historical context of this paragraph is early homeopath lacked the knowledge of homeopathic mimetic theory, and even Dr. Hahnemann was has not discovered the mimetic theory, and antisoric remedy were discovered later on, and many cases improved but not permanently cured. So clinical understanding is that not all improvement is equal to cure. Need to assess depth of the disease, miasmatic level also, and superficial prescribing, temporary relief, and deep acting remedies that are the only the true cure. So, friends, this is the understanding about the how the foundation for the foundation for the true cure started and natural treatment started and how the majma was introduced. So this form speaks about the majmatic understandings. So these are the two paragraphs, and we'll shall come back again with the next paragraph. For the meantime, thank you very much.